Hello, we are Team Vital Voices, Dustin Emerson, Chaunice Hackney, and Jeanene Zagajeski. Our project is titled Breaking Barriers to Global Health Equity. In conflict zones, health inequality isn't just about the amount of aid sent. The real challenge lies in whether that aid can actually be distributed to the people who need it most. Failures in distribution ripple out across food security, mental health, and education, making recovery almost impossible for families. Our research identified three interconnected root causes: food insecurity, limited access to mental health care, and educational inequality. Each one compounds the others, and when distribution breaks down, the cycle of inequality grows deeper. We chose Gaza as our case study because it shows these problems in stark detail. Blockades and infrastructure damage limit food and medical access, schools are disrupted, and mental health issues such as anxiety and PTSD rise sharply. It demonstrates how distribution barriers create cascading harm. Anxiety, depression, and PTSD are among the most common outcomes. Without proper care, these conditions don't fade. They intensify, affecting entire communities long after the immediate conflict. Physical health suffers too. Chronic conditions like diabetes become harder to manage, malnutrition spreads, and preventative care like vaccines and checkups disappears, leading to preventable illness and readmissions. Education, which should provide stability, is often interrupted. Refugee systems are overcrowded and underfunded, leaving children with literacy gaps and reduced chances for advancement. There are solutions: food programs, education initiatives, and mental health interventions, and each shows promise. But on their own, and especially when distribution fails, none are enough to close the gaps. This reflects the gaps in research. Studies often measure the amount of aid delivered, but rarely examine how distribution failures undermine outcomes, especially for mental health and education. Our creative solution is to pair aid delivery. Medical relief travels with trauma counseling, and food relief is paired with education specialists. Delivering these together means families get multiple layers of support at once. We also point to the Philippines as an example of decentralized leadership, where local governments are empowered to coordinate responses. This shows how integrated aid can work when decision-making happens closer to communities. Taken together, our model directly advances three sustainable development goals: zero hunger, good health and well-being, and quality education. Addressing them side by side strengthens progress across all three. In closing, solving health inequality isn't about sending more aid. It's about making sure that aid overcomes distribution barriers and addresses multiple needs at once. By integrating food, health, and education, we can help families not only survive but also recover and thrive, moving closer to real global health equity.